Hello, this is Dr. J. Hartley at the Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. And today we're going to be going over the CAS exercise and Scolibalance exercise for a right thoracic curve. Now these exercises are very specific. They're not meant to be done without being under the care of a Scolibalance or a clear doctor. CAS stands for Scientific Exercise Application for Scoliosis. It's an exercise based in Italy, and Scolibalance has made some modifications to it, and I'm a Scolibalance certified provider. So when we look at a right thoracic curve, that's a curve that's going to go like this. So a lot of bracing in medical world, they're just doing a 3-point reduction or pressure on that curve. The thoracic curve is more of a corkscrew. So the exercise to reduce the thoracic curve is an uncorkscrewing of the spine. So the upper thoracic spine here goes forward like this, and the lower thoracic spine goes like that. So it creates a corkscrew. So the exercise is going to do just the opposite of that. So the lower spine, we're going to shift it to the left, uncorkscrew it this way, and then we're going to uncorkscrew the top of the spine. Ideally, there's actually a little bit of an overcorrection. And then we're going to hold that posture. The simplest exercise is just a static posture, so it's more of a conscious exercise, and we know that posture is really a subconscious system. So once we get to where we can hold that simple position, then we can make it more complicated. We could juggle a ball. We could raise one leg up and down. We could put the body on an unstable surface as long as we're holding our sits bone or our pelvis in a stable position. So I'm going to go ahead and show you the exercise now. So if I have a right thoracic curve, usually your right translated like this. So first I'm going to elongate. I'm just going to lift my head up. I'm going to lift my shoulders up, creating some traction in the spine. Then I'm going to translate my spine to the left. And next I'm going to bring the lower thoracic curve forward. So I'm pushing forward here. And then the last thing I'm going to do is I'm going to bring the right shoulder back, but I'm going to keep this forward and I'm going to keep my pelvis stable the whole time. So you're just holding this position as long as you can. You're keeping the elongation, keeping this forward, keeping this back, counter-rotating the thoracic spine. If we were to take an x-ray in this position, we would ideally see a reduction of the curve, and then that would be confirming that this is the right exercise for the patient. And then we can make it more of a dynamic exercise. While we're holding this position, we could do rows with a strap. We could do juggling. We could have the person sit on an uneven surface. We could alternate having one leg up. So all these different things. So you hold that correction as long as you can, forward here, backward here, translated, pelvis stable, elongating. Hold it as long as you can. When you feel the positioning is starting to fatigue you, you don't hold it as well, then you just relax out of it, but don't go all the way to your bad posture, just kind of in the middle. Relax for a second, and then you'll go right back into it again. You'll elongate, you'll translate, keeping the pelvis stable. You'll bring the lower right thoracic curve forward. Then you'll bring the upper right thoracic curve backward, holding the right anterior lower thoracic forward, and then you hold that posture, okay? And you just hold it, and you want to build up to where you're doing it for 10 minutes continuously. And then when you can do that, you'll add some of these more dynamic functions, which I'll go over with you in the office. So again, this video is geared toward me teaching my patients in my clinic this exercise. It's not to be done without the guidance of a Scolibalance or a clear certified scoliosis doctor. This is Dr. J. Hartley from Hartley Chiropractic and Scoliosis Center. You go out there and make yourself a great day.